This is Sandra recording for Bree and doing enteral feeding.
So, first I'm going to introduce myself to the patient. My name is Bree and I'm here to be your nurse today. Can I get your name and your date of birth? Got it. Here's your wristband. You don't have one. But I'm guessing that you are who you say you are. So, your doctor ordered some nutrition to go through your feeding tube today, so that's what we're here to do. I'm going to perform hand hygiene.
I'll try it. We'll see what happens when you
Okay. First, I gotta listen to your belly here.
Alright, I'm gonna go grab my phone.
Okay.
At this point, I'd also measure the patient's abdominal girth. So I'm also going to get a baseline weight from the patient, and I'm going to check the lab values. I'm going to make sure that there's no fluid volume deficit or excess. I'm going to check for metabolic abnormalities like hyperglycemia and also another abnormality.
My name is Eric.
I don't remember. Okay, I'm also going to check the healthcare provider's orders and make sure that we have the right route, the frequency, and the amount of the formula. And I'm also going to check the flush, the amount and the frequency for the flush. So for feeding tubes that are placed in the abdomen, you're going to check the insertion site for skin breakdown, for irritation, and for drainage discomfort. And then I'm going to perform hand hygiene and go gather all my supplies. So when I come back, I'm just going to measure out my stuff here. Electrolyte abnormalities, that's the one I forgot. That's also what we're measuring. So I am going to check the patient's, ask the patient for their name and the date of birth again, and then match it against what was ordered for the patient by the physician. I am going to measure everything out here. I'm going to check the integrity of the can and make sure that it's not expired. And let's see. Making sure that my feeding tube, or my tube feed is at room temperature, and then shaking the can well.
Once that's checked out,
I can't have this one. Okay, close to you too, because they said they want to see.
Alright. So I am going to perform hand hygiene again, and then I'm going to set the patient's head and let up. Again.
Alright, so I'm going to walk into the room back in the bed. I'm going to ask for
Performing hand hygiene and applying gloves.
Were you the partner?
Yeah.
You were worried. No, I shouldn't. Okay, good.
Want my tube feed fell out? Or broke? Or both?
Okay, and then I'm going to measure the abdominal girth and the abdomen. And after that, I'm going to assess for laboratory values. I'm going to check for fluid volume, excess or deficit.
Okay, so just aspirating gastric contents here. We're going to note the amount of the contents and also note the appearance of the contents. As we push this back, so every time you do intermittent feedings, before each feeding, you should aspirate the gastric residual contents. And then if it's
after I
continuous
check that,
feeding,
I'm
do it
going
every
check
4 to
the
6 hours.
The route, the frequency of my order for the feeding. I'm going to also check. I'm going to also check the frequency or the how much I need to give for the flush.
Measuring the pH level here.
Hand hygiene over again. And
All right.
hand hygiene. And I also, before I do that, I want to check the insertion site of the
I'm not worried all this is going to come out.
feeding tube, just to check for any drainage, or any
Flushing
remnants of
first.
swelling or inflammation or discomfort that the patient might have with it. So I'm going to perform hand hygiene now, and I'm going to make sure that the patient is in alcoholic position, so at least 30 degrees or higher.
So, while you're doing that part of
And then, okay, so now we're in hypotenuse position. I'm going
no, we're on this together.
to my all my feedings I got, and I'm going to before the only thing I'm going to check the integrity of the container. I'm going to
Okay.
also check once
So we can leave that site open to air. Don't have to put a gauze or anything on it. So when intermittent feedings are not in use, you're going to cap or clamp the proximal end of the tube feed with the feeding tube. Also, we're going to rinse the bag and the syringe and the tubing with warm water whenever feedings are interrupted, and get a new administration set every 24 hours. And then I'm just going to remove my gloves, perform hand hygiene. I would reapply gloves and provide oral care, then remove my gloves, perform hand hygiene again. And then I'm going to tell my patient that it's probably best to stay in this above 30 degrees position for at least 30 minutes to keep from aspirating on the feeding that we just did. And then for a while after, I'm going to continue to monitor lab values and the patient's respiratory status, and also assess for the patient for comfort. Is that